I feel like it's day and night. I'm functioning. Like I'm gaining back who I lost to OCD. And for the first time ever in my life, OCD is not at the forefront. It doesn't control what I do. It doesn't control where I go, what I say.
Welcome to Curing with Sound, a podcast presented by the Focused Ultrasound Foundation. I'm your host, Allison Preston Smith. At just 6 years old, Rima Youssef of Toronto, Canada, started experiencing symptoms of obsessive-compulsive disorder, a debilitating condition that often disrupts every aspect of life. By age 12, Rima was diagnosed with OCD that left her unable to attend school or even play outside. In 2019, the obsessive thoughts, depression, and anxiety returned despite prolonged medication and therapy to manage the condition. In 2021, Rima participated in a clinical trial at Sunnybrook Health Sciences using focused ultrasound to target specific areas in the brain that had the potential to ease her OCD symptoms. Just 3 months later, she saw the first glimmer of hope. A year and a half later, she was able to return to work and is now thriving. Rima, welcome to the podcast, and thank you for sharing your experience with us.
Hi, Allison. Thanks for having me.
So let's start at the beginning. What was it like as a 6-year-old kid suddenly getting these obsessive thoughts and depression and anxiety?
Yeah, I don't think that I knew what was happening. I remember, the thoughts would just become really sticky, and that was all I could focus on. I was slow to respond if my mom asked me questions, or I was just kind of only in my headspace and very fixated on whatever I was thinking about, or very worried about whatever the obsession was, and I didn't know how to relieve it, or I would come up with these, to me, they were like these tricks of how I would soothe them, which I now know were compulsions, but I was pretty terrified. I didn't really know or understand what was happening. I think I quickly realized that other people didn't have the same experiences when I would get so stuck in obsessions that I was in my own world and was not really aware or paying attention to what was happening, or it was definitely very scary.
Yeah, that sounds so scary and so difficult. And when you turned 12, you were forced to leave school and your symptoms escalated even more throughout the next few years. So can you tell us about that experience?
Yeah. So when I was 12, I think that's when things got really intense. And at this point, I think we kind of knew that it was OCD prior to getting a diagnosis, but I was not able to go to school because I would just have a panic attack, or I couldn't go out into public. So I was 12 when they were kind of like, yeah, you have OCD. And because I have a parent who has OCD, I kind of knew what it was. I didn't really know what these things meant, but I knew that it meant that you got scary and bad thoughts and you had to do stuff to make yourself feel better. I ended up doing a course of CBT, so the cognitive therapy and exposure response therapy, in a hospital program during the day. And I finished that and was placed on medications, and things were good. Things were really good. I was able to, what I thought, conquer and take over OCD and slay the beast of OCD.
Mm-hmm. Did you return to school or were you still staying at home?
I returned to school in 8th grade, I believe. I think the period of time when I had left 7th grade and went to treatment, I was in treatment for many months during the day, and so I wasn't until the following year that I was able to return.
And then when you were 19, is that when it started to escalate again and when the cognitive behavioral therapy and medication wasn't working as well?
Yeah, so I think in 2019, my OCD symptoms came back, but they came back with it was a completely different obsession, different compulsions. And at that point, I no longer had any connections to the therapeutic world. So I was kind of trying to figure out what to do. Um, I was really fortunate, and I had actually reached out or was at Sunnybrook, and I was connected to a psychiatrist, and I completed the Thompson Center program. So initially, I was actually going to go to the States for the residential OCD treatment programs, but a spot in day treatment opened. And so I did a full course, I believe it was 12 weeks, of the cognitive behavioral therapy and ERP, so like the intense therapy at the Thompson Center through Sunnybrook, and of course, changes to medications. I was okay for a year and a half or 2 years, probably a year and a half. And then it came back.
Mm-hmm. And what were some of your compulsions that you were experiencing?
Yeah, so I think from age 6 to recent, the compulsions were either hoarding, so, but not in the traditional sense. So it could be as simple as like a piece of garbage was on the floor, and I would need to pick it up, take it home, and keep it. And if I didn't, there was this very real, intense fear that something terrible was going to happen. Um, and at one point, some of my compulsions were around mucus or germs. And so I couldn't touch things. That meant even things in the house, whether it be light switches, door handles. I, at one point, lived in this tiny room in my parents' basement, and would not let anyone go in except for me, and only I could go in after taking part in showering. Showers took a long time. I would wipe my face with Lysol wipes.
Oh my gosh. Was that painful?
Emotionally, I think so. Physically, I don't think my skin was happy. Um, but at that time, like I knew that if I didn't do it, I would pay the consequences, and I had to listen to what OCD said. And so I stopped being able to hug my family. I couldn't have dinners with them. I couldn't pet my dog. Being anywhere or around people was just too much. At one point, I developed this weird, almost like a whack-a-mole OCD. So, like, I would wake up in the morning, and maybe the night before I went to bed, and I was just needed to wipe or clean things. But then I would wake up and have like this just right kind of OCD. And so I would need to make sure I said or did things that felt just right, or like close and open the taps until it was just right, or check the door and to see if it was locked. Or then I would need to like take a certain amount of steps, or I had no idea what was happening. I mean, I've had OCD for as long as I can remember. I know what OCD is. I had done therapy. I had done different kinds of therapy. I had tried over 10 medications. I also feel like 10 is on the lower side. Um, I, I had done everything that I could possibly think. And at that point, I just thought OCD was going to win this one. Like, OCD was, I could not take OCD on at that point.
And when did you first hear about Focused Ultrasound and what was your impression of it?
Yeah.
Did it seem like it was going to be too good to be true?
So when I was told, or when my OCD became treatment resistant, I was at a place where I was like, there is literally nothing that I could risk that would be worse than what I'm going through. So I had actually stumbled across the focused ultrasound surgery on the Sunnybrook website. And I had sent an email one night out of like complete desperation. This is my last step. Like, this is the only thing that has a chance of making a difference. And when I was approved, I signed the papers in person, or I had gone in for an appointment, and they gave me the paperwork, and they're like, like, take it home and you can look it over with your family. And so, like, mid sentence of the doctor speaking, I was like, here you go. And they were like, oh, like, are you sure? Like, I was like, I've been thinking about this since 2019. So may I please have the next date available? Um, because it's in clinical trial, and they're only working with such limited resources. I think the world has yet to discover how much this can impact and change someone with OCD's life. And because there's only a small group of people who will probably have treatment resistant OCD, it's it's hard for, I guess, the world to see the impacts that this surgery actually has on your life as a person with OCD.
And during the procedure, did you feel anything, or was there anything that you noticed?
So I guess after they shaved my head, they placed the halo, or that ring. I was given the sedative, and um, I fell asleep, and I remember nothing after that until waking up in recovery. So in terms of pain, I would say that it was a smooth ride.
Mm-hmm. And how did it feel in the weeks afterwards? Did you notice a change right away, or did it take a while for you to notice any differences?
Yeah. I don't think it was until my 3 month mark. And I remember because I, at the time, would use my sleeve to open the bathroom door. And um, I reached for the door, but then there was this second of, wait, why are you using your sleeve? And at, like, for me to have even contemplated why I was using my sleeve, considering that prior to surgery, I like, it was just a no go. Like, there wasn't even considering why we're doing a compulsion. Um, when I say we, I mean my OCD and I. That, I think I was a little freaked out, truthfully, because I was like, wait, they told me I had to wait like 6 months to a year. Then I was like, oh my God, I think that something is kind of different. And I had even gone to the grocery store, which at the time was really big deal. Yeah, that was pretty significant, considering they were very truthful and upfront and said, look, like, you probably will not notice till 6 months to a year mark, but I'm pretty sure there was something going on at that 3 month mark with that incident.
And when you were at the 6 months to a year mark, what did you notice then?
At 6 months to a year, I think progressively things were getting a lot better. I was able to make more progress in my therapies in terms of like the cognitive therapy or psychotherapy. I noticed that at that point in time, I actually had the ability to fight back against OCD and to do some of the exposures. I think that, things started to radically change around the year mark, and around year and a half, I had returned to work.
And what was that like?
Oh, I was terrified, um, but it was probably one of the best feelings. Work was always one of those things that um, I just felt OCD had robbed me of the ability to do. And um, I remember saying to my therapist over and over of like, I just so badly want to be able to go to work. Like I so badly just want to be able to walk down the street and do what everyone else is doing. So it was great.
And was there any point where friends or family started to notice that you were getting better and having less compulsions?
Yeah. I think probably around the year mark, I think they could definitely see the changes. I remember friends saying to me that I seemed more hopeful. And at that point, I was talking about and working towards going back to work. I think the big thing too with my family is that I could actually hug them and I could touch them. And we're a very tight knit family. So for me to not be able to hug or kiss them was a big thing. I have a dog who is my child. I could actually hug him and kiss him, and it was okay. And I think he was a little upset during the period of time where my OCD was bad because he was like, what the heck is happening?
Oh, and how are you doing now? I mean, it's been 3 years since your procedure. Does it feel like a lot has continued to change, or how are you feeling?
I feel like it's day and night. I I think even having this conversation and having to think back and reflect, I realize how intense and how bad things had gotten. I am back at work full time. I just recently actually took on a new role at work, and I feel like I'm flourishing. I can essentially do anything most people do in the sense like I can go out into public and I won't have a meltdown or a panic attack. I can touch, I'm going to say almost everything because, there's some things that typical people, even without OCD, probably wouldn't do. Um, but my brain is different and I still have OCD. I still have obsessions and sometimes compulsions, but like super mild, I think. But I'm functioning. Like I'm gaining back who I lost to OCD, and I'm rediscovering who I was or who I am or would be had I not had OCD. And my brain is just different. Like it's there. I will always have OCD, but OCD is not at the forefront. It doesn't control what I do. It doesn't control where I go, what I say. For the first time ever in my life this year, um, started doing advocacy work and speaking about my story
Oh,
and using
wow.
that as empowerment.
That's amazing. We're so glad to hear that you're doing well and that things are going well with work and life and that you're, being a leader and a trailblazer to other people with OCD. And so this treatment is still in the clinical trial phase. But what would you say to someone considering joining a clinical trial for OCD treatment or getting this treatment?
I would say do your research. I looked at the Sunnybrook page, but I actually also looked at the foundation's page because I am very much into research. And one step at a time. I mean, talk to your loved ones or the people in your circle of care and ask questions. I would do it all over again in a heartbeat, but also remembering that it's a long process, and in the sense that the surgery is not going to completely fix your OCD, but it can make very significant change. And yeah, I mean, I would say there's always hope. There's always something you can do. There's never a dead end, even when it feels like you've reached that place.
Well, thank you so much, Rima, for sharing your story and telling us about your experience. We really appreciate it.
Thank you. Thanks for having me. I guess very quickly, I just really want to thank the folks from the Focused Ultrasound Foundation, as well as the folks at Sunnybrook and the people who make this happen and folks who continue to talk about this. I hope that one day this surgery is not just a clinical trial and that it's a part of treatment, because you can get your life back. You can go to work, you can contribute to society like everyone else, and it makes a difference.
This episode of Curing with Sound has been presented by the Focused Ultrasound Foundation. If you would like to learn more about Focused Ultrasound or the Foundation, visit our website at fusfoundation.org. You can also sign up for our newsletter and follow us on social media.